Thank you,
The
Speaker.
member for Oshawa.
Thank you very much, Madam Speaker, and I'm glad to be able to pose a question to the member from Whitby on his remarks on Bill 175 about home care and access to appropriate care for folks. He and I, of course, both are from the Durham region and appreciate the important work that the folks at Lakeridge Health do on a regular basis, both at the hospitals and out in the broader community. I had spoken at length about the experience of at Lakeridge Health, Oshawa, and the hallway medicine and hallway healthcare. And I know that there are significant concerns in the Durham region and pressures with alternate levels of care beds. And I would ask the member, because I am unable to find it in this bill because I don't think it's there, but can he please explain where in this bill we would see the legislative provisions that will indeed improve the quality of care for patients?
The member for Whitby.
Thank you, Speaker. And I thank my colleague from the riding of Oshawa for a question. You know, from my experience, particularly in my riding and the complaints that I hear in my my constituency office, far too many of my constituents have complained about falling through the cracks or left trying to coordinate their own care on their own. And currently, those that are seeking home care can face multiple assessments, and that's a common complaint. And added to that are the long waits. And I think one of the other aspects of this particular legislation that speaks to improving the patient experience is the care that the frontline providers who have long argued that home care and community care, the experience should be vastly different than what it is. But they spoke specifically to their role in that, their role and need to be a key advocate for their constituent, for their patients.
Question. Member for Oshawa.
Thank you very much, Speaker. And I'm happy to pose a follow-up question because we do know that the quality of care for patients is key to keeping folks well and healthy out of the hospital and cared for in their homes. This bill does not have those provisions that will improve or guarantee the quality of care for patients. The government has been talking about a system that they envision and imagine, but we do not see the how to get there in this bill. This bill does not lay that out. So I would ask, first of all, to see where in the bill we have those guarantees. My other question is, in this bill, it addresses the Private Hospitals Act, and that includes residential accommodations. I would ask specifically if the transitional care beds out in the community at facilities, at the retirement homes that will be used as transitional care beds, if those facilities will now be considered private hospitals as per this legislation. Thank you.
The member for Whitby.
Thank you, Speaker, and to my colleague from Oshawa. When I spoke on this particular bill, I talked about why we intend to modernize home and community care and bringing an outdated system design. Last time it was changed was in 1994 into the 21st century and integrating it with the rest of the health system. And that's the key part. It's the integration. That's what patients have asked for. That's what our constituents have asked for going forward. So for patients with needs too high to return home, but who don't require the intensive level of care provided by a hospital or long-term care home, Speaker, will increasingly have access through this particular bill to residential congregate care options. And this is a key piece. This is a key piece for seniors in our community. And I mentioned being at the Senior Centre on Green Street this past weekend, and I spoke to some of the seniors about some of the features of what congregate care is going to be able to provide for them.
Question.